There we go. So, yeah, Nas is good. Thank you everyone for showing up. And I just had a quick icebreaker that I wanted to do just to kind of to kind of get us in the spirit. And I don't know if you all had some time to reflect or not about your 2025 or any intentions that you have for 2026. If you don't mind, just briefly in the chat or even unmuting yourself to share just, just that one win that you may have had in 2025 that you're proud of, or that one intention you are carrying into 2026. No one? Let's see, let's see. All love. Na says all love. Amalia, the year of gratitude. Yes, the year of gratitude, the day of gratitude, the moment of gratitude. Gratitude, I don't know if you all know this, but it's actually good for our physical health, our heart health. It helps, the gratitude helps us to reset and to kind of like if you're ever in a bad mood or you have anxiety or any kind of like self-doubt going on, usually kind of it's a way to kind of shift your thought process. So one exercise that I do often and when I'm in that space is I say five things that I'm grateful for. It could be something as simple as me just being safe and me having a home. Um, Paula says 7 hours of sleep each night. Yes, yes. I had six last night. Good for you, Paula. Hayden, I don't drink a sip of alcohol in the year. I didn't drink a sip of alcohol in 2025 and continue to practice this. It was and is liberating. Thank you so much for sharing. And we are proud of you, Hayden. Um, Mutau says learning to be better each day. Anthony Johnson says good health. Okay, and Stacy, Dr. Schott says, strive to be kind to everyone. To everyone, the world is in a difficult place. Yes, definitely. When I see things happening and when I'm reading about things, I have to remind myself that there are good people in this world, including myself. So just remember that there are good people, and at the end, that positivity, and at the end, we will all prevail, and just keep, to be kind to others because you never know what people are going through, and your act of kindness could make someone's day. John Williams says, improving myself daily. And Alvin says, be a help to anyone in need. Yes, thank you all so very much for sharing. And if you haven't already, the link for the attendance is in the chat. For myself, I say my intention for 2026 is intention. I'm sorry, my is the intention of giving myself 10%. We we give to people that we love. We give to our jobs, to our businesses, to our communities. We give to everyone else, and so 10%. I could give myself 10% of the day for myself first before I give it to everyone else because I deserve that. So that's my intention for 2026. So I'll thank you all for sharing. Okay. And so let me change my view so I can get a gallery view. There we go. It's better for me, multitasking here. All right, so for today's agenda, I'll repaste it in the chat box. Again, everyone, thank you for sharing. I wasn't sure how that was going to go, and I know we really did warm up, so thank you. So for December, our session focused on collective impact and cross-sector partnerships. And we did share a checklist for you all. And I wanted to know if you had any questions regarding the checklist or what we talked about, or any new ideas or asks that you may have for myself or us at Cause Engagement or your peers or even the Maryland Department of Health. That was loaded. So the checklist and any key takeaways or any questions or asks that you may have. Oh, and Peter, and I thank you, Peter, for your comment as well. Is this to be more intentional with growth emotionally and mentally? Um, Chris, I will, this is my first time meeting you, and I will address that question later in the later via email. So thank you for your inquiry. For that checklist for December, is there anything that one item that you found to be useful or that you've actually applied or you plan to apply? Okay. It's giving you all some time to process. Okay. If it's okay, I'll move on to the next agenda item, which is the upcoming peer learning sessions. And so I did share with you all in advance via email. You can also check in the chat and I'll share my screen and I will, just in case some folks don't have the visual, I'll recite what I'm saying. But so we have 4 peer learning sessions. During our first meeting in November, we shared that a part of the plan, in addition to the 7 HHLC meetings, we'll have those 4 community peer learning sessions where they're open to the public. And last month, in addition to the cross-sector collaboration, we also had a presentation from Florence Champagne, and she talked about calcium scoring and awareness. And so based off of that recap for those of you who weren't in the previous meeting, we decided that we would move forward with, everyone agreed that was attending, that we would move forward for February for to include her for that topic on calcium scoring. So she'll share her personal story and then also talk about what calcium score testing is. We did invite a physician to also participate in the event that folks have medical related questions. However, if you are a a licensed healthcare professional, such as a nurse practitioner, nurse, or a medical doctor. And if you happen to be available on Tuesday, February 3rd, please advise. You can just simply just send me an email. And if you would be available as a backup, that would be appreciated. Or if you have any recommendations. And so all of the sessions are scheduled to start at 6 p.m. The second session in March would focus on heart health between appointments, so managing medications, daily care, and nutrition. I have identified a nurse practitioner, Angel Shannon. I'll share her information. With the team. And then for May, I'm gonna skip over April. And for May, that's mental health month, mental health awareness month. And one of the topics that you all mentioned was managing stress while caring for a loved one with heart disease. So we'll have a licensed counselor, Walter Williams. He presented last fiscal year as well. And then for April, the reason why it is in orange is because I believe it was you, Alvin, that mentioned crisis, or how to respond in the event of a crisis. And crisis could mean more than one thing. And so my initial interpretation of that was planning ahead for your heart health, making decisions. So this is your advanced directives, your any wills, trusts, and ideally this would be like a patient advocate who would help to facilitate and serve as a guest speaker on here. But then also, I just wanted to get clarification from you all. When we talk about crisis, could crisis also mean responding in the event of cardiac arrest, or be fast, what to do in the event if someone has signs of having a stroke? So at this time, I'm just asking for clarification from you all regarding that proposed April topic as it relates to crisis. I just wanted to make sure that I'm interpreting that correctly, or if you're neutral on that, that's okay as well. Okay. Okay, I don't see anything in the chat related to this. So we're okay with the topics as is. Can I see some emojis, some yeses? Is anyone opposed to the topics? And if you have your hand raised, just simply unmute yourselves. Okay.
I am interested in attending, I think the one for March 3rd and May 5th. But for March 3rd, I'll have to see my schedule. But it's something I would like to learn more about.
Perfect. Thank you, Serena, for sharing that. And then also in the chat, I see Edna. She would like to know what to do in the event of a heart incident. And so, um, what I'll do is I'll offline just kind of work that into the April topic. And if we need to change the title, that's fine. We have time to plan. We're only in January, but I just wanted to make sure that I'm getting the feedback from you all. So thank you, Edna, for Reverend Jenkins, excuse me, for uplifting that. Um, but in the meantime, thank you, Angela and Anthony, for your feedback and how to act fast too, Alvin. Okay, because we do have Be Fast, a Be Fast session that we developed, and we actually developed it in English and Spanish, and we have a workbook. It's in Basecamp, and it's from fiscal year 25, and it's still available. So an emergency event, maybe even CPR. Okay, that's what we'll do. I'll thank you all. I'll make sure to update the April topic. But for that Be Fast, I still make sure that I share those resources with you from last year, because we do have a resource list and a lot of information that it's for the Healthy Heart Learning Collaborative to use any resources or anything that we have developed. Okay. And as it relates to, give me a second. As it relates to our meetings, we are here in January, and today, in addition to our discussion, we also, as I mentioned on the agenda, we're featuring our members of the Healthy Heart Learning Collaborative. I'll introduce them in a few. But then also, I just want to let you all know that for February, we do have a public health pharmacist. She's also a public health consultant, and the topic will be on GLP-1 therapies and how they relate to cardiovascular prevention. I'll share that abstract or those learning objectives with you via email and also in Basecamp. And we are applying for CHES for this February 12th. So today we will not offer CHES, but in February we'll offer the certified health education specialist credits for that as well. I got to practice saying not saying And then in March, the proposed topic is basically on food as medicine. So food access, nutrition literacy, and food as medicine approaches. And this is more so of how we can integrate food-based approaches into heart education and care. And then for April, I kind of wanted to leave it a little bit open just in case something arises that we may want to talk about. So I kind of left that topic bank open. But everything that you all are mentioning or have mentioned, we are keeping a log of those different topics. And then in May, we'll have our wrap up, and then we can even plan for fiscal year 2027. Okay. All right. And any questions so far? Are we all good with the direction so far of the Healthy Heart Learning Collaborative? Yeah. Okay. Okay. Let's see. Yes. Thank you. Okay. So at this time, I will actually hand it over to the Maryland Department of Health. So before we have our HHLC member spotlights, um, the staff at Maryland Department of Health, they actually want to go over that Healthy Heart Ambassadors resource guide with you all and to receive your feedback. So please don't be shy. Please give them this information. It's going to help them with implementation, and then just making sure that they're sharing out the resources that are relevant and that it is what, they're here to serve us. They're here to serve you, to make sure that is what you need. So at this time, I'll step back and I'll hand it over to Muftal. Muftal, you are muted.
Okay, can everyone hear me now?
Yes.
Okay, and can everyone see my screen? All right, so yes, good afternoon, everyone. My name is Muftal Shinaba. I'm the Healthy Heart Coordinator here at the Center for Chronic Disease Control and Prevention at FIFA, and today I will lead the discussion on the Healthy Heart Ambassadors Resource Guide. So, as always, we have our mission and vision for for FIFA. So, our mission is to protect, promote, and improve the health and well-being of all Marylanders through our public health efforts. And our vision is that for all Marylanders and their families will be able to enjoy optimal health and well-being. Here, I would like to provide an overview of the HHA resource guide and the request for feedback and commentary. So, why the resource guide? Why how did it came about? So, the center, we wanted to provide program facilitators with a list of approved resources for the program, and it was intended to streamline the messaging and at the state level, especially when you go transitioning to blood pressure monitoring cohorts. So some of the approved resources, it's non-exhaustive, and there'll be more once I share the link. The approved resources include the flyer, content that may include blood pressure logs, pre and post assessments, readiness scales, as well as educational materials, including those that are promoted by the American Heart Association, the Centers for Disease Control and Prevention, and the National Institute of Health. So I wanted to provide an example of one of the assets that we have available. So this is the flyer that the local health departments will utilize when promoting their respective cohorts. And as you can see, you may wonder why there's white space down there at the bottom of the flyer, but that's to allow the local health departments to input their contact information and key links to their resources that they may have. And of course, if you want to, I will drop the link in the chat for those who need access to the HHA program materials to view. So this was released prior to the December HHLC meeting, but in case anyone would like to take a second look, I will put this in chat right here. Please let me know if you are able to access it. You can put a thumbs up if needed as well. Thank you for that, Anaya. All right, so if you wish, please open up that link and go through some of the files. And if you have been able to read it before, that's even all the better, because now I want to posit some of the discussion questions as a means for the HHLC membership to provide feedback. So for any of these questions, you can unmute yourself and or leave any comments in the chat. You may raise your hands however you would like to elicit feedback. So I do have these questions for discussion below, and I can begin with this first question. For the assessment and readiness documents, are they easy to understand for the facilitator and the participants. Shawnta, you had your hand raised.
Would you mind sharing the screen, that link on Basecamp for while we have folks here, so maybe they could see what it looks like? And I know they said they have access, but I think some folks may not.
Okay, very well. We can.
Yeah. And th- and then I know it's kind of hard for you to see the chat while you're sharing your screen, so I'll read the responses in the chat. Angela, she says that she finds the red text is challenging to read for those with lower vision.
The links are blocked where it says program material. It says you have to
Program materials.
sign into Google or something.
Oh yeah. So Serena, thank you for that. So as a workaround in the Basecamp link, I was able to upload hard copies of all the HHA program materials in case there was any issues with the links. So if you scroll down in the chat thread, I was able to upload versions of the logs and assessments and the like available. I was hoping because I did see that when we did provide links in its initial stages, I did notice that some individuals may have had trouble accessing our direct file. Yeah. So, and please let me know if because I can also provide direct links to the files proper for viewing.
Anaya, please.
I do notice some trouble with the participant readiness scale. So although we do have like the instructions clearly outlined there, sometimes with the scale, I do realize that I get questions on what exactly the ratings are, I guess, aligning to.
Yes, Anaya. Yeah. So I'm sorry. Yeah, apologies in advance, but you were a little muffled the voice there.
I'm sorry, can you hear me now?
Much better.
Okay, I was just saying that sometimes I do notice during the enrollment process that there are some questions with our participant readiness scale. So I notice sometimes they get a little confused with the numbering of the rating.
Yes. Oh, thank you for that, Anaya. We'll definitely take that into the consideration. So, yeah, and some of the file, yeah. So the readiness scale, you said that some people may have a little trouble understanding how to score in their 1 to 10 in certain items. Yes.
Yes, and I do notice there as well that there are instructions outlined at the top, but I think that maybe the structuring of, I guess, the different statements and then the reading on the right side kind of confuses them. So it could just be a situation of kind of explaining or reiterating the purpose of the numbering for the scale and how it kind of combines with the confidence level in those different statements.
Got you. Completely understood there, Anaya. Definitely, we can take that into consideration for future updates. So, yeah, definitely. Thank you for that. So, I am reading some comments in the chat. Angela referenced that the red text may provide some challenges to those with limited vision. Paula's perspective is that we should take literacy into consideration. Some items, wording such as hypertensive, as an example, we need to rethink about how some of the wording is, just so everyone can understand better. Thank you for that. And then John, you were recommending that sending the direct link to the files and the emails would actually help a lot better. we actually can, if you want to provide more feedback ad hoc. So let me know. We can provide those links towards the at the after the meeting. Thank you for that. And then, of course, relaying Alvin's comment that the red text may not be clear to everyone to see. And yeah, I'm glad everyone's able to provide feedback, especially the rationale behind these.
Also, the font is kind of a little bit small.
The font's a little small in which document, Serena, if I may ask?
When you first pull up the Google Docs, it pulls up a little bit small. Where we seeing like, yeah, it'll be smaller, but I guess we can zoom in, but sometimes I kind of want it a little bit larger when we first click on it.
Yeah, usually
And
when you click larger, I think hopefully it zooms in better. Yeah, so on Basecamp, yeah, if it's difficult to see, you can click on the documents. That will give you the full view of the
oh,
items.
and some of the it's kind of saying it's sensitive, and Norton's blocking one of the links.
Um, but yes, definitely. And like I said, Serena, yeah, if you wish, we can add direct links to the files for further viewing and evaluation.
Thank you.
Fred, you're thinking about making sure that is compliant for all accessibility portions. Thank you for that comment there. So, yeah, so I can see the literacy skills. I see the pros and cons there. I want to quickly transition to another item real quick. So, when looking at some of the materials, would the materials be helpful for someone participating in the program? So, as we see here, it's not just programmatic materials that we have provided in the chat, but there's also hyperlinks to key items such as dash plans, how to take blood pressure measurements, and ways to improve healthy habits, all as examples.
Some link to like a video should be provided as well.
Yes, so
And some
yes.
people are visual learners.
Okay, so I can actually pull up one of the videos. Give me a second. Yeah, so, and then also, just in the grand scheme, what topics would be considered something that would be that should be getting more attention, especially when you're trying to address monitoring, trying to have individuals have improve their blood pressure monitoring habits and adopting healthy lifestyle changes. Yes. So, yeah, so for the questions there, while I bring up the items, let me quickly go ahead and bear with me, guys, to get the videos up.
And while you're doing that, so just time check, we're at 3:33 and we do have some HHLC member spotlights. I'm not saying stop now, but just to kind of let you know of that. But then also in the chat, Angela, she says that all of the American Heart Association materials are very well done, but but they're just pricey. I don't know if there is some type of way that the Maryland Department of Health or how any suggestions do you have to I'm not putting you under pressure now to respond to that, but that's something that we could respond to as it relates to like the price and the cost. Na says that yes, the materials are practical and easy to follow. And then Anaya agreed with Angela. And then Angela also says that at the Charles County Department of Health, they use a SALT brochure from ETR Associates that is very good. And she'd love for that to be added to the resource list.
Yeah, thank you so much for the feedback and commentary provided. So, yeah, we'll definitely take all that into consideration. And of course, if you have more, please continue to drop suggestions in the chat. I will provide the links to the video as promised as we transition to our next set of the meeting. So, Shawnta.
Yes, thank you so much, Muftal and team, and thank you everyone for giving that feedback. This was a really, I think once we compile it and share it with the team at the Maryland Department of Health, they'll see that it's really robust and it's really helping them to move forward with the next best step. And Reverend Jenkins would like to know, can you provide free materials for distribution to communities and faith-based organizations? And I think that's a question for everyone that is on the call that's a part of a health department or an organization. And Florence, when you say Me Too, I don't know exactly what you're referring to as it relates to Me Too, so please expound on that. And so next on, and then also, I thank you for the comment. I can't recall who made the comment. I'm not, as it relates to plain language and health literacy. So remember, literacy is someone's ability to be able to read the information the first time and understand it the first time and be able to use that information. And so last fiscal year, we did have a presentation by the Horowitz Center for Health Literacy as it relates to health communication and plain language standards and guidelines. And so those presentation slides are available in Basecamp. And so I'll make sure to reshare that as well. And again, like I mentioned, for example, in April, we don't have a topic date. So as things come up and these topics come up, if you all have any recommendations for what we want to spend more time on, we can do that. Florence Champagne says she needs materials too. So Muftal and Emily will put, and Olivia will put that on the list for to help to facilitate that so that we can make sure we share resources with community members and our community partners. And so at this time, the HHLC member spotlights. The intent of this is to help it's the relationship building, it's the collaboration, it's the practical application, but then also the best practices. It's good for individuals with lived experiences to know what's available out in our various communities across the state. It's also important for all of us as peers to understand what it is that we're all working on. And so there may be some best practices that could be shared, but then also some of our presenters and some members of our team, they're having issues, and any type of support or advice that you can provide is beneficial for them as well. So we're all here as reciprocity to support each other. And so we have Marissa Smith, and she is the Cardiovascular Disease Prevention Coordinator with the Office of Advanced Primary Care with the Maryland Department of Health. And we have Paula McKenzie presenting, Director of Physical Health and Nursing with Allegheny County Health Department. And then Hayden Rhodes. And so Hayden is a coordinator of special programs with the Mid-Shore Health Improvement Coalition through Kent County Health Department. And so they have about like 5 to 7 slides. They're not really, it's like mini presentations. And so what we'll do for the purpose of time, let's let all 3 individuals present, and then we can open it up for any large group discussion, if that's okay. And then we'll start with you, Marissa, first, and then Paula, and then Hayden. And so at this time, I'll step back and allow you all to share your screens.
Sounds good. Thank you, Shawnta. I'm going to share my screen. Okay. If there are issues with the screen sharing, just let me know. I cannot see the chat, so feel free to unmute. Okay, so as Shawnta said, my name is Marissa Smith, and I am the Cardiovascular Disease Prevention Coordinator with the Office of Advanced Primary Care at the Maryland Department of Health. And today I'm just going to give you a brief overview of my role and the team I work with here at MDH, how we engage practices in heart healthy work for a national cardiovascular grant, and a sample of some resources that we've developed for this project over the past year or so. So first, I'm going to talk a little bit about the structure of the Maryland Primary Care Program. And here's an image depicting it on the screen. So as you can see, it's broken up into participants. So participants include practices, federally qualified health centers, and care transformation organizations. And then the admin who support these practices. So that's me, my coworker Raghavi, who's on the line, and also I don't think she's on the line today, but we usually have a coach, Prissy, who joins us, Priscilla, who serves as one of our practice transformation coaches. And we're all under the Office of Advanced Primary Care. The people who usually work closest with practices are the practice transformation coaches who meet with practices one-on-one and support them in care transformation and work towards delivering advanced primary care. So they provide technical assistance, which can include support with using things like CRISP reports or workflow review and management, as well as provide them with clinical resources. And then just to note that because the state is transitioning models within the federal government, our move to the AHEAD model, which people might know about if you work at one of the local or state health departments, but just to note that the federal government is rebranding our program MDPCP as MDPCP AHEAD, but MDPCP is continuing as is for now. So all the information I share is and still will be relevant. So here's a snapshot of participation in 2025. So we had about 460 practices with 500 practice sites across Maryland, and we served about 350,000 attributed Medicare fee-for-service beneficiaries. The map to the right shows that all the participating practices in every county across Maryland, and you can see the density is obviously around Central Maryland, with Baltimore City, Montgomery County, and Arundel and Prince George's being pretty high. This slide depicts how the OAPC engages primary care practices participating in the Maryland Primary Care Program in the National Cardiovascular Health grant work, which is what I mentioned earlier. So this just gives a little bit behind the scenes of how we speak and work with practices. So the top in the yellow just notes practice facing and practice interactions, and then the OAPC is our work behind the scenes. So we start out with meeting 0, which is kind of a level-setted meeting. We conducted an orientation where practice staff received information about the grant, the goals, what we're going to help with, what we're offering, and they decided if they wanted to participate in the project to improve their cardiovascular disease processes and supports. Then our team comes back and we do some prep work. If the practice accepts and wants to move forward with the project, the OAPC will chat with an internal team and dive into practice data to get a comprehensive picture of the practice before we meet with them again. So this can look like talking to the practice coach, pulling data and geographically looking at where the provider's at and what populations they serve. Then we go to the practice with meeting 1. So the OAPC meets with practices to evaluate current capacity and workflow. So it's more of a conversation. This includes processes for e-referrals, SDOH, and other barriers, as well as addressing their own goals when it comes to CVD. Then we come back and do evaluation and development of interventions. So the OAPC conducts like literature reviews, connects with stakeholders, develops resources, creates a plan for each practice with suggested interventions. So this ranges from process improvements to usage of new tools, development of new resources specifically for the practice, things like that. We go back to the practice for meeting 2. The OAPC presents findings and discusses implementation of the practices. So what will it look like if we implement this workflow change? How are you going to use these resources? Things like that. And then we offer follow-ups. So OAPC provides continual support and provides follow-up for each practice enrolled in this project. So I'm just going to end with a few examples of resources we've developed for this project and for practices specifically. So here are 2 examples of ones the OAPC has developed. On the left is the National Cardiovascular Health Toolkit. So the OAPC compiled all these resources and passed it out to practices. So it's a resource that houses CVD-specific resources and improves ease of access for care teams. So it hosts interactive and educational resources for care providers to use on their own or with patients. So you can see the top box, it's a little small, but the top box is MDPCP and CRISP resources. So like how to use CRISP, social need guides, things like that. And then we have physician-specific resources. Then we have patient resources the physicians can share with their patients. And then on the right, we have another example of a resource we developed. So one practice we worked with that had several practice sites noted that veterans compose a large part of their population. So this resource that the OAPC developed compiled a bunch of information at the state level for veterans. So since following up with this practice, after providing them with this resource, a social worker at the practice said it was very useful to have everything in one place and that she can use these resources with a lot of her patients. In that vein, one lesson in success we learned through working with these practices is that taking the time to tailor resources specifically to individual practices and their patient populations is always appreciated and definitely worth it as it supports specific patients at the practice. We continue to welcome feedback from providers that we work with and anyone on this team for the benefit of resources and resource types. And then one more resource I'm going to share. I'll note that this is one resource that's a little bit long, so I cut it in half so we can see the whole thing, but some challenges, opportunities, and next steps. The sample here is a resource that we developed from a literature review on best practices for team-based care and specifically relating to CVD. This was also provided to care teams, so social workers, case managers, things like that. There's a great opportunity for care teams to use this resource in their huddles and meetings to standardize patient care. One challenge was applying general team-based care best practices to specifically cardiovascular disease frameworks, and also adapting this resource and the takeaways we found to be applicable to all sizes and types of practices. And just as a reminder, for feedback purposes, our office does not work directly with patients. We work with care teams, so like primary care physicians, care managers, social workers, etc. So all these sample resources are given to providers and care teams at primary care offices, and they don't go directly to patients. So that's it for me. I'll welcome any feedback or comments at the end. Thank you.
Perfect. Thank you, Marissa. And for those of us who are not public health professionals, as Marissa stated, with their office, with the Office of Primary Care, a part of the Maryland Department of Health, what they do is they work directly with practices, not with individuals, not with patients. And so what they do is they help to build the capacity of those various practices, whether they're smaller or larger practices or not. And so they assign a coach, like a practice coach, to support them. They kind of do some assessments and help them to improve on ways that they can improve their processes, protocols, operations as it relates to serving patients for cardiovascular health or for heart health. Okay, and their challenges. One of the challenges that I heard Marissa mention was that team-based adoption, just to getting the practices overall to kind of adopt what it is that what they are sharing and what they're trying to support them with. So thank you so much, Marissa, for that. And at this time, I'll pass it over to Paula McKenzie with the Allegheny County Health Department.
Hi, thank you. Let me share my screen. Okay. Can you see the screen okay?
Yes.
Okay. All right. So my name is Paula McKenzie. I'm with the Allegheny County Health Department, and I am the coordinator of our Healthy Heart Ambassador program. I must admit I was a little bit unsure about doing a presentation because our program is so new. But I'm just going to tell you, where we are in the process, and hopefully that might help others as well, or anybody who might be thinking about either joining as a patient or maybe taking on a program through a church or something like that. So just to give you, a little bit of background with Allegheny County, we're a small county in Western Maryland. We have a population of just a little over 67,000. residents, and of those residents, about little over 20% are elderly, 65 and older. We are almost double the state of Maryland in our residents who are under the poverty level, as well as education statuses. We do have a high rate of cardiovascular or heart disease in our county. Heart disease is the #1 cause of death in Allegheny County. And a statistic that I found with our community needs assessment when we were applying for this grant is our 5-year mortality rate is almost double in Allegheny County what it is for the state of Maryland. So when we got the grant application and we're deciding whether or not we should apply for this grant, it was pretty much a no-brainer for us because high blood pressure is definitely a problem in our county. About 35% of our residents have been told by a healthcare provider that they do have high blood pressure. So that is our statistics in a nutshell. So we applied for the grant. We were approved. April through June of 2025 was pretty much our planning, trying to figure out how we were going to roll out this program. And then after the new grant application was approved, the new budget, we started outreach and trying to reach people in our community. So we did take in our first group of clients in October of 2025. So they're about halfway through their first session. And our plan is to start the next group in February. We do have another grant where we are, it's the chronic disease tobacco grant. So we are utilizing that funding as well. And we are hoping with that funding to actually start a group. The cohorts that we have right now are all individual sessions. And we do have 2 part-time Healthy Heart facilitators that work with those groups. Our partners are the BCCP, so Breast and Cervical Cancer Program. We are the hub for the Breast and Cervical Cancer Program. What that means is we take people in Garrett, Allegheny, and Washington counties and help them get screened for both breast and cervical cancer. So while we are working with our BCCP here, we are also assisting Washington County with their Healthy Heart program. And by doing that through our BCCP program, they can refer Washington County patients to the actual Washington County Health Department to help increase the numbers for that program. So that has been going well. Our reproductive health program here at the health department is fairly new. We have had that for a little, I'm going to say 1.5 years now. And as anybody who's ever tried to start a program, it takes about a good year to get things up and off the ground, but they are increasing their patient load. They see male and female patients. And in talking with the nurse midwife that runs that program, what she told me was about 50% of her patients have high blood pressure. So we're utilizing them as a referral source too, and trying to get patients into our program that way. We're also working or getting ready to work with the Maryland Physicians Care, which is the MCO for Medicaid, one of the MCOs for Medicaid in our county. They work with Hauling for Hope. And once we get the MOU signed, then we will be able to work with them. They deliver food boxes to their high risk, some of their highest risk Medicaid patients in the county. And so we hope to receive some referrals that way as well. And one thing that we're excited about is hopefully in the next month or so, maybe even this month, we have a program called Food for Friends, and that is a medical meal delivery program that is going to be moving into our county. So we hope to utilize them as well. And we are still seeking a partner for our food bank requirement. So just to give you a little sense of where our referrals are coming from, our website, we have an interest form on our website. And if someone is visiting our website either through Facebook or actually going on the internet and Googling the ACHD, there's a form on there that they can fill out. It has very general information in that form. Once they hit submit, it goes directly to our Healthy Heart Ambassador facilitator, and she reaches out to them to see if they are eligible for the program. Our biggest referral source right now is our TOPS program, and the TOPS facilitator is also our Healthy Heart Ambassador facilitator. So she has a great relationship with the people who attend the TOPS meetings. And so she did have 7 of those people sign up for our Healthy Heart, and they are in the first cohort. And then we also have a nutritionist here at the health department. We're very blessed to have her. She's very active in the community. She sits on our food councils, both at the local level and the state level. She teaches our nutrition classes for the Healthy Heart Ambassador program, and she is just a gem. And one thing that we did work with her on this past year is we did a grant through chronic disease where we worked with local farmers and distributed healthy food to SNAP beneficiaries. And we also got those farmers signed up to be able to accept SNAP at their farms. So that was a really big deal for us here in Allegheny County because we do have, like I said, a higher poverty level. So our plans, I know I'm running out of time, I'm going to wrap this up. Plans is to just try to reach more community members through advertising, social media. We have a very active AM station where they do a live radio program in the mornings, and they allow people to come on and talk about their programs. So we're going to utilize that, and then just trying to get out to the other places like the food pantries and things like that. Successes is using our programs that we already have and the relationships that we've already established through them. And then our challenges is we haven't been able to secure an MOU with a food bank just because a lot of our food banks are church based, volunteer, and that's just not something that they're able to take on. We did get some suggestions from MDH and are trying to see if we can fix that, but that's been I would say, our biggest challenge. And then our opportunities, I think with this program, we really do have the opportunity to change people's lives. We all know that knowledge is power. And if you can provide someone the ability to understand their condition and make informed decisions, then that really is the key to a healthy lifestyle, I think, and a success. Trust does come with time. So because this is a new program, we're still working on our trust building with our community. COVID didn't do us any favors there, and especially public health. So we're building that, not only in this program, but in all programs. So that is the end of my presentation, and I will turn it back over to you all.
Thank you, Paula. So Marissa and Paula, there are questions in the chat, and so feel free to respond to any of those. I do have some feedback, but let's go with the agenda, and then if we have time, we can. But thank you so much for sharing. And so next we have Hayden Rhodes, and Hayden is with the Midshore Health Improvement Coalition. Through the if I'm saying this wrong, Hayden. So you're with Kent County Health Department. Is it like a dual program, or you'll explain that, and I should just step back?
No, it's okay. I don't plan on talking much about it. My boss started something called the Midshore Health Improvement Coalition. And so what that entails is the 5 Midshore counties here on the Eastern Shore. We get together quarterly, and we discuss different things that would benefit the Midshore region. We have over 100 community-based organizations involved. And then off of that, we have smaller work groups that get together more frequently. We have provider recruitment and retention. So not just getting doctors here, but actually getting them to stay here. Ideas around that, diabetes, tobacco prevention, health literacy, health equity. So we just have different work groups on how to work together as a community. And for the greater good of the residents here on the Eastern Shore.
Thanks, Hayden, for the clarification.
Yeah, of course. So I'm going to share my screen now. Let me see. Share. All right. So we're gonna do. Can you guys see my screen? Yes. Okay. Let me go back to that. All right. So this is about the Healthy Hearts in King County, and kind of like the previous presenter, this is fairly new. We just finished up our first cohort here in the county, and it was a success. So with that being said, the program overview. So the health department recently concluded its inaugural Healthy Hearts pilot program, which achieved success with an average class size of approximately 7 participants. And in response to the program's positive outcomes, our health department has allocated funding to a community-based organization to expand our initiative, offering additional classes throughout the county during the winter and spring of 2026 period. With that being said, we strategically placed our first class in a central location where it is lower income because transportation is an issue, which we'll talk about later on in the presentation. But we placed it in an area where attendees could actually walk to the class. And so, yeah, heart health has emerged as a strategic priority in King County, largely due to the region's social determinants of health. The county's rural nature and the high prevalence of families living at or below the poverty line underscore the critical need for targeted interventions to address cardiovascular health disparities. Programs and partnerships. So we have the Healthy Hearts Ambassador class. We also have a tobacco prevention initiative here. And as we all know, well, we might not all know, but tobacco use does correlate with hypertension and heart disease. We have an annual outreach to healthcare providers and community-based tobacco cessation grants and strategic partnerships. So, for our Healthy Hearts Ambassador class, we provided self-monitored blood pressure screenings with complimentary AMRA monitors. The program also offers nutrition education, focusing mainly on the DASH diet, and promotes regular physical activity for better heart health. For our tobacco prevention partnership, we collaborate with the Maryland Quit Line, and the department offers robust tobacco cessation services to support individuals in quitting smoking, whatever that looks like. Patches, lozenges, gum, different things like that. And an educational component comes along with that. The annual outreach to healthcare providers looks like luncheons to healthcare offices within the King County region where the Maryland Quit Line is promoted. Providers receive referral forms, educational posters, and literature to share with patients. And the community-based tobacco cessation grants are department funds local organizations through mini grants aimed at promoting tobacco cessation for both youth and adults across the county. And because of those partnerships, we're able to expand our promotion of the Quitline and the Healthy Hearts Ambassador Program because they promote it to their network and patients. And our strategic partnerships collaborate with a diverse array of community-based organizations, including but not limited to the Maryland Food Bank, the King County Public Schools, the YMCA, local Alcoholics Anonymous chapters, churches, Parks and Recreation, and more. And we have an inclusive mission behind that because by working with these varied community entities, our goal is to reach and support individuals from all backgrounds, regardless of age, race, gender, or socioeconomic status, wherever they are at on their health journey. And that little picture up there, that's just an example. We just did a Santa's workshop with the Parks and Rec. We promoted our Healthy Hearts class there. And that little poster says, Santa Claus says, the only thing smoking this year better be your chimney. So who we serve and why, priority populations. So the focus is placed on adults with or at risk for hypertension, seniors, underserved or rural residents, and individuals with limited access to healthcare services. These groups experience disproportionate challenges in managing and preventing heart-related health issues. We use a data-driven approach, so our services are informed by statewide health data and local observations, highlighting the critical need for heart health interventions in King County. And I believe I'm saying this correctly. King County just received additional funding to launch additional Healthy Hearts cohorts, and I think there was only one other county in the state that received it because our numbers were so quote unquote bad. Early prevention and education, emphasizing the importance of proactive health measures. We aim to shift the focus from reactive treatment to preventative care. So providing Healthy Hearts education equips our residents with the knowledge and tools to take control of their heart health and reduce the risk of cardiovascular problems, and empowering residents by promoting self-management strategies and offering tailored resources. We empower Kent County residents to make informed decisions about their health to hopefully reduce long-term health disparities. An example of this is our lovely participant who allowed us to take our picture. We did a tour of the store class and practice reading nutritional labels on groceries. So that's an example of how we empower residents, and that is what the photo is showing. Goals and engagement. Short and long-term goals. Our short-term goals for our Healthy Hearts class: enhance blood pressure management through consistent monitoring and education, increase participation in heart-healthy behaviors, such as regular physical activity and discipline to dietary guidelines, example, DASH diet, and boost engagement in heart health screenings to identify at-risk individuals early. Our long-term goals are to achieve sustained improvements in blood pressure control across Kent County residents, foster a lasting culture of healthy lifestyles that continues beyond initial interventions, increase the rate of early detection and intervention for heart disease through expanded screening programs. In our outreach and engagement strategies, community engagement, which promotes participation through diverse outreach methods. And we currently include local events, providing Quitline referrals, delivering one-on-one educational sessions, and leveraging social media platforms to reach our broad audience, and culturally and socially responsive programs. And through that, we prioritize the delivery of programs that are both culturally and socially appropriate, ensuring accessibility for all community members, regardless of background. The picture shows from one of our classes an example of different ingredients they could use to make a pizza DASH diet friendly, and substitutions. So successes and lessons learned. Through our diabetes prevention program, in collaboration with a community partner, we successfully launched a diabetes prevention program. Who is the same community partner is now launching our second Healthy Hearts cohort. And that created a significant contribution to improving the long-term health outcomes of King County residents. Our nicotine Nicotine and Tobacco Anonymous chapter, which, as mentioned, nicotine use severely increases the risk of cardiovascular disease. So thanks to grant funding, our local Alcoholics Anonymous group that we funded has expanded its services by launching a Nicotine and Tobacco Anonymous chapter, providing critical support for individuals seeking to quit tobacco use. And because they are promoting that, they have promoted the Healthy Hearts program, and some of the attendees of our Tobacco Anonymous chapter has now enrolled in our second Healthy Heart cohort. And for the Healthy Heart cohorts, by the summer of 2026, Kane County will have completed 3 cohorts of the Healthy Hearts program, which began in October of 2025. This initiative is central to our ongoing commitment to the heart health education and prevention across our community. Challenges and opportunities. As any rural county, I think, can agree, transportation is a huge challenge. It limits access to reliable transportation, which often prevents participants from attending health programs and appointments, particularly in rural areas like Kent County. Time constraints is another one. Busy schedules, particularly for working adults and caregivers, create significant barriers to regular participation in health initiatives and screenings. Awareness is another one. So many residents may not be fully aware of what's out there and the heart health resources, services that are provided, or the importance of preventative care, which typically leads to lower engagement, and funding limitations. Insufficient financial resources can hinder the expansions and sustainability of our heart health programs, limiting the ability to serve more individuals and communities. Support and next steps. We want to continue ongoing partnerships. We are committed to maintaining and strengthening our existing partnerships with healthcare providers, community organizations, and local stakeholders to ensure the long-term success of heart health initiatives in King County. To piggyback off of that, to the right, the photo is a partnership we created with a private chef who specializes in dietary food and nutritional food. So she came into our second to last Healthy Hearts class and cooked our participants a Dash Diet friendly curry chicken soup. She made homemade sourdough to go along with it. And she taught them how, just because you have to eat quote unquote healthier, it doesn't have to be bland or gross. So that was incredible. Our continued funding, securing sustained funding is essential for the continuation and expansion of our heart health programs, enabling us to reach more individuals and provide critical services. And lastly, our vision for the future. Looking ahead, we envision a thriving, heart-healthy community in Kent County where ongoing partnerships and innovative programming continues to drive positive health outcomes for residents of all ages and backgrounds. And that is all I have. So back to Shawnta.
Thank you, everyone. I want to clap and hearts and thank you for the presentation, for stepping up. We are almost at time. Don't worry about the evaluation form. I'll email it to you all for everyone to complete it, and you will be able to give feedback to the individuals as well, the presenters. But in the meantime, there are questions and comments in the chat. Let's speed respond to it if possible. Do you offer your services for the ones that provide services to the community? Do you offer for youth and young adults as well?
Yes, we do. So we offer vaping initiatives and tobacco prevention initiatives through the schools. For example, our YMCA last year, we funded them, and they did bi-weekly science and history classes on tobacco use, and they actually got really creative with it. They had a great outcome with children. They dissected, this is an example of a pig, and they put the arteries in formaldehyde, and they told them that is what is in your vape pods, to kind of like really allow it to resonate with the children. and it kind of freaked him out a little bit, which is not necessarily a bad thing. The high school was able to take their funding and use it for vape detectors in the schools. The Parks and Rec did CPR classes for kids and adults. So they all kind of we encourage them to get creative with the funding because, as we mentioned, tobacco use does lead or can lead to cardiovascular disease and hypertension.
Okay. Thank you for that. And then also, Paula, as it relates to the food bank, there was the recommendation from Florence regarding the capital area food bank. And so the question is if they operate in Western Maryland. Florence, if you can answer that for her. But then also, I put in the chat, there is another food distribution partner that I know that even goes outside of the state of Maryland. So if they can go outside of the state, they can come to Western Maryland. But the question is, it's a source of funding. So I do know that this organization, the Storehouse, if an organization has funding for social determinants of health or food distribution, you can purchase from them, and then there probably even can be some partnering and capacity building for the food distribution. So that's just a resource there. Florence says she'll check as it relates to the capital area food bank and the Shabbat Ministries as it relates to Western Maryland.
Thank you.
And so we are at time. Next week, I'm sorry, next month, as I mentioned, we do have a presenter and we're talking about GLP-1s, but then also we do have some more room on the agenda. And I believe that the Maryland Department of Health, they may kind of give a brief overview, a brief overview of what it is that they're actually providing to everyone, so you can we all can see the bigger picture. But then also Amalia Rivera Oven from the Mid-Atlantic Association of Community Health Centers, she'll present as well. And so we won't add anything else to the agenda, so we can leave time for that. And then even today's discussion, what I would propose to do is a recap based off of the meeting minutes. I'll be sure to share that, and then also the information that's in the chat, and we can circle back to anything if anyone has any outstanding questions or suggestions. Is that okay with everyone? Okay.
Yes.
Okay. And so if you have time, I thought I put it in the chat. I didn't. If you have time, stay on and complete the evaluation form. If not, we 100% understand, and we'll make sure that we email it to you. But I'm looking for that form. Sorry, multitasking here. Okay. So I believe that's the correct link that I just shared for the evaluation. So if you could take your time to do it now, that's fine. If not, like I said, I'll send you an email, and you will have the opportunity on that evaluation form to provide feedback to Hayden, Paula, and Marissa as well, and to also move Tao regarding the resource guide. So thank you, everyone. This was a really good, productive meeting, and yeah, just very much just thank you. I'm grateful just to kind of see this come to fruition and what it is that everyone is, what we're all doing together. All right. And so have a great day. Thank you.
Thank you.
Yeah.
And so Florence, as it relates to your question regarding the flyer for the peer learning session, I'll follow up via email. I meet with the MDH team, and so that way we can start promoting it. So I'll let you know. You're muted.
Okay, sorry. Thank you.
Okay, thank you. Okay, see him move to. I'm going to sign off now.
Very well. Have a good one, everyone.
Thanks, everyone.